Thank you, Swen, and the organizer for your invitation. So, I'm not in the field of aging, even though cancer can also be considered as an age-related disease. But I work with a drug that may have application in aging, as we saw this morning. So we're working on metformin and its new application in the field of cancer. So I just want to say that I have no conflict of interest in the field covered by my lecture. So here is what we are going to talk about, and we're going to finish by a little bit about metformin and aging, but some people talked about it already this morning. So, what is metformin? Well, metformin is isolated from a plant, which is the French lilac. It's a biguanide, and it is known from the Middle Age as an hypoglycemiant drug. Metformin is now prescribed to almost 120 million people in the world. It's a very popular drug to treat diabetes, and it has the advantage to have a few side effects. For the treatment of diabetes, we know pretty well the action of metformin. In liver, metformin will decrease glucose production. It will also act on the adipose tissue to increase glucose transport and decrease lipolysis. And in the muscle, it increases fatty acid oxidation and glucose transport. All these actions results in a decrease of hyperglycemia with no risk of hypoglycemia, and a decrease of insulinemia. Okay, in 2005, one epidemiological study came out from a Scottish cohort, where they studied diabetic people taking metformin, and what they showed in this epidemiological studies is that diabetic people taking metformin have a reduced risk of cancer, and in fact, all types of cancer. And several others retrospective studies came out and were published for some specific cancer, for example, your prostate and breast cancer, and recently even meta-analyses were published to show that in diabetic patients, metformin reduces the risk of cancer, offering to this drug new perspectives. And this, for French people, was the opportunity to show our heroes and to say that, well, is metformin a magic potion that could help to treat cancer and that also treat diabetes? From these epidemiological studies, several laboratories started to perform preclinical studies using metformin. And these preclinical studies were performed in mice. For those who are not familiar with the model we are using in cancer research, most of the studies were performed using nude mice and injecting human cancer cells under the skin to follow tumor growth, but also using transgenic mice that develop spontaneous tumors. So what we did in the laboratory is to study the growth of xenograft tumors of prostate cancer cell lines in mice. So we gave the mice metformin in the water, and as you can see here, compared to mice who were given water only, you observe a nice reduction of tumor growth in mice treated with metformin. And these studies were confirmed using several other models, and here I presented a model using pancreatic cancer cell lines, where you can see that once again, in xenograft, metformin reduced significantly the growth of tumors. Concerning transgenic mice that develop spontaneous cancer is a study by the group of Dario Alessi, who showed that in the P10 plus minus mice who developed multiple cancer, when you gave these mice fenformin, which is an analog of metformin, you can see, if you measure the occurrence of tumors, that mice that received fenformin have a delay in tumor appearance, and by the end of the experiment, they even have less tumors than mice that received in control mice. Recent study by the group of Philippe Denis, working on lung tumor, showed that when they give when they treated mice with NNK, which is a potent inducer of lung carcinogenesis, for 3 weeks, and then they gave metformin IP or vehicle to mice, and what they showed is that indeed you have a reduction of the tumor volume in mice treated with metformin and a reduction of the serous lung tumors per mouse. So, and this study made the headlines of several newspapers. Yes. So far we've shown that metformin by itself was able to decrease or reduce tumor growth in mice, and several other laboratories thought of the combination of metformin and chemotherapeutical agent. And that's what the group of Yiannopoulos did here. What they did is they performed an experiment in nude mice, once again, using xenograft of breast cancer cells. You see that when the mice are untreated, the tumor grows pretty nicely. When you give the mice doxorubicin, a powerful chemo drug, you can see that tumor growth is slowed down and appear with a delay. And when you treat the mice with metformin alone, here it's in red, you inhibit tumor growth. But when you combine doxorubicin and metformin, you completely inhibit tumor growth. Not only there's an effect on tumor growth, but they also showed that the combination of the two drugs target specifically cancer stem cells. As you can see here, they measure the a marker of cancer stem cells in the tumors. From these studies, so from these preclinical studies, if you go now on the NIHtrial.com site, you will see that more than 20 clinical trials are going on and are recruiting patients to test the efficiency of metformin, most of the time in combination with chemotherapy. One of these clinical trials was recently published by a Japanese group. What is important in this clinical trial is that they treated non-diabetic patients. They treated them for 1 month with metformin and looked at the formation of aberrant foci, which are the first sign of colon neoplasia. And what they showed is that people who were treated with metformin had a significant reduction of the number of ACF. So this is very encouraging, but we are still waiting for larger clinical trial and more evidence that metformin can really and truly affect cancer growth in patients, in non-diabetic patients. So it will take probably 3 to 5 more years to have the answer to this question. So what we are doing in the laboratory is to understand how metformin can act on cancer cells. Is metformin acting through a paracrine or an endocrine way on and indirectly on cancer cells? Or is metformin acting directly on cancer cells? Why do we have these questions? As I showed you previously, metformin results in a decrease of insulinemia in the body. And insulin is a well-known growth factor. Therefore, we can think that the decrease of insulinemia may slow down tumor growth proliferation. To answer this question, the group of Michael Pollack in Canada performed a study giving their mice high-energy diet, in fact, high-fat diet. And you can see that when you give high-fat diet to your mice, you have an increase of tumor growth. Here in red. In parallel, you observe an increase of insulinemia in these mice. Then they added metformin to their experiment, and as you can see, you got a strong reduction here in green of tumor growth with metformin in combination with high-fat diet. And in parallel, you got a reduction of insulinemia, but not that much. Still significant, but you still have a high level of insulin in this mice. Meaning that insulinemia may not be the only answer to explain the results we have on tumor growth. There are also effects that have been studied concerning metformin, at least hypotheses on the role of metformin on tumors. Metformin can act on immune cells metabolism. It can also act on adipocytes, and we know that adipocytes play an important role in tumor environment. And it can also act on inflammation and on the synthesis of TNF-alpha. But what we are more precisely studying is the direct effect of metformin on cancer cells. In fact, the first study published on this direct effect using cancer cells and adding metformin to the medium were performed by the group of Pollack. What they showed is that in breast cancer cells or in ovarian cancer cells, when you cultivate them with metformin, you significantly reduce the growth of these cells. We did experiment, Issam Ben Sarah did experiment in our lab using metformin in different line of prostate cancer cells. And similarly to the previous study, we observed a significant reduction of cell proliferation in these cells. Interestingly, we got a very diminished effect of metformin in epithelial cells, in normal cells, suggesting that there may be a specific effect of metformin on cancer cells. What we are doing also, as you know, one of the problems of cancer is also the formation of metastasis, and metastasis is a reflex of cancer cell migration. And recently what we have shown is that metformin is also able to stop cancer migration. Here are assays where you visualize cells that have migrated, and as you can see, when you treat cells with metformin, you have a reduction, a significant reduction of cancer cell migration, showing that metformin may also be useful to reduce metastasis. So now, at the cellular level, what are the mechanisms that are implicated in metformin action? We saw that there is a direct effect of metformin, and how does it work? So we have shown in prostate cancer cells that metformin in fact blocks cell cycle. Cell cycle is a series of events that allows cells to duplicate their DNA and to divide. And we have shown that when we treat your cancer cells with metformin, you have a reduction, a decrease of expression of cyclin D1, of PRB or E2F1, proteins that are very important and play a key role in the progression of cell cycle. Other people working in other cancers, such as breast or melanoma, have also shown that metformin is able to induce apoptosis in human cancer cells. So what we have shown is that metformin is able to stop cancer cells to proliferate through cell cycle arrest, but it can also, in certain type of cancer, and that's not the case in prostate cancer, for example, induce apoptosis, but it can also block cancer cell migration. Now, what is interesting also is that we have found that metformin is able to target cancer cell metabolism. The first study showing that metformin can affect metabolism, and especially mitochondrial metabolism, was performed at a group of Xavier Leverbe in France, who showed that metformin inhibits the complex 1 of the mitochondria in hepatocyte, normal cells. So we ask the question, do we have the same effect in cancer cells? And in fact, that's the case. When you treat cancer cells with metformin, you can see that we have an inhibition of the activity of the complex 1 of the mitochondria, similar to the effect of rotenone, a very well-known inhibitor of the complex 1. And if you block the complex 1, you block the oxidative phosphorylation chain, and then you block the synthesis of ATP. And indeed, what we have in these cells is also a strong reduction of ATP concentration when you treat with metformin. As you may know, there's two main pathways to synthesis ATP in cells. One is the oxidative phosphorylation pathway that generates a lot of ATP, and the other one is glycolysis, which generates only 2 molecules of ATP. When we treat with metformin, we observe that we have a decrease of the oxidative phosphorylation chain, and in parallel, probably to compensate, we have an increase of glycolysis. So we decided to combine metformin with an inhibitor of glycolysis, which is 2-deoxyglucose, which is an analog of glucose, but not metabolizable by the cells. We looked at cell proliferation. When you treat cells with metformin alone, as previously shown, you have a reduction of cell proliferation. Now, when you treat with 2-DG, the inhibitor of glycolysis, you have a similar inhibition of proliferation. But now, when you treat with both agents, you inhibit the two main sources of ATP in the cells, then you target cancer cell metabolism, you strongly inhibit cellular proliferation. And in this case, whereas with metformin alone or 2-DG you do not induce apoptosis, here the combination of the two agents induce apoptosis in prostate cancer cells. So, now let's come back to a notion that several of you have talked about, the mTOR pathway. Because when you talk about energy stress in the cells, you think of the AMP kinase. The AMP kinase is a kinase that is highly sensitive to a decrease of ATP in the cells. And when you treat with metformin, indeed, you can see an increase of phosphorylation of ATP. This increase of phosphorylation of AMPK, will inhibit the mTOR pathway, and will inhibit mTOR, an energy-consuming pathway that plays an important role in cell growth and protein synthesis through notably the phosphorylation of the S6 ribosomal protein.